Hello everyone, welcome back to my channel. If you're new here, my name's Dr. Rashay. Staff and students call me Dr. R for short. And I'm going to bring you the last line of these play series of how to read the NCLEX questions. Today, we are going to go with exposure. Again, this is getting into a little bit more of emergency medicine. However, you will definitely need this for part of the priorities when it comes to the NCLEX questions. All right, let's look at our first question. All right, we're going to break everything down as we normally would do, which is the first step is going to be read the question entirely just to get an idea. So, a nurse is caring for a trauma patient who has been involved in a motor vehicle accident. The patient presents with multiple abrasions and bruising, but is complaining of severe abdominal pain. What is the nurse's priority action regarding the patient's clothing? Now, we're going to go back. We're going to start picking out some key words. First thing we're going to pick out, we have a nurse and we have a trauma patient. They've been involved in a motor vehicle accident. So now we have the patient that's presenting with multiple abrasions and bruising, but their chief complaint is severe abdominal pain. Priority action regarding patient's clothing. All right, so those are some of the key words. Now we have patients in a trauma setting. So they're probably going to be in the emergency room, obviously in a trauma bay. So the setting is very important. And we want to know what is the priority action when it comes to the patient's clothing. All right, let's take a look at our answer choices. Option A, cut away the clothing to assess for additional injuries. B, leave the clothing on until the physician arrives. C, ask the patient if they consent to having their clothing removed. Or D, gently removing the clothing to prevent further injury. All right, so again, a trauma patient, we do not want to play around. Let's see what the answers are. What do you think out of all these options we're going to be picking? We're going to be cutting away the clothing to assess for additional injuries. All right, so an emergency medicine exposure is get them naked. We want to cut off the clothing. We want to get them exposed. Why is this so important? Well, a lot of times if we have a patient that comes into the emergency room and maybe they're being altered and confused and we have to figure out what's going on because we're playing detective, right? Sometimes we don't have a full picture and clues of what's going on until we take and cut their clothing off. So maybe they're altered, right? And we have no idea why they're confused with their presentation. Well, it may not be until we cut the clothing, all of a sudden we look at the belly and we see ecchymosis starting to appear or bruising to appear, right? Then we press on the belly gently, extremely gently, and we feel it's firm. The reason why they are confused is because they have internal bleeding. Does that make sense? All right, let's look at our rationales. Okay, in trauma cases, especially when internal bleeding is suspected, it is crucial to assess the entire body for additional injuries. Again, sometimes we may have people that come in and they've been shot or stabbed, and they're not even aware. And it's not until we remove their clothing that we see, oh, okay, there's a puncture injury or there's a gunshot wound, and we need to see, is there an exit wound with the entrance wound, right? Cutting away the clothing allows for a thorough examination of the abdomen and other areas without compromising the patient's safety. Leave the clothing on could delay necessary assessments and interventions. Remember, this is an emergency type situation. While consent is important in emergency situations where the patient is unable to provide consent and immediate assessment, it's crucial The priority is to ensure the patient is stabilized and all injuries are identified. Yes, it would be nice to ask for consent. Remember, a lot of times asking for consent is as simple as saying, I'm so and so, I'm a nurse. We're going to go ahead and start to treat you, and we're going to start removing your clothing and things of this nature. Is this okay? Um, if they're able to answer, great. If not, then again, it's appropriate to just go ahead and pull out your trauma shears and start removing the clothing. Gently removing the clothing may not be sufficient to assess for serious injuries in a timely manner. Remember, we need to get the clothes off. We may have to take and stabilize them and roll them. And we're going to be checking for, again, whatever type of injuries might be on their back, buttocks, thighs, whichever. All right, I hope that this was helpful. Please leave me some comments below. Tell me what you think about these video series. And I'm going to be starting another series that's going to be coming along shortly for nursing students and how to address things whenever you are in school. All right, have a good day, everybody.